My name is Jeff Owens. I'm a practicing urgent care physician assistant in Philadelphia, and I recently joined EB Medicine's team as an education consultant to help meet the needs of organizations that are growing rapidly and really looking for an education and training resource to help get their clinicians up to speed. So what is evidence-based urgent care? So it's a monthly journal for urgent care clinicians committed to lifelong learning, those who want to partner or mentor for ongoing education throughout their career. Our mission at EB Medicine and evidence-based urgent care is to help clinicians integrate evidence-based decision-making into clinical practice. We start that process by having expert physicians review all of the evidence on a given topic, combine that with their clinical experience, and present you with practical recommendations that you can use on your next shift. Each monthly issue is going to focus on a single topic that's relevant to urgent care. It's written and peer-reviewed by clinicians practicing in urgent care, so you know that it's going to be relevant to your clinical setting. Your subscription will include access to all of our new issues, as well as our library of previous issues. Each article includes 4 CME credits, so total you can get over 50 CME credits each year. So I'm going to pull up the website so we can see it live here. All right, so all of the content that you can be accessed on our website or our mobile app. You can also print and save a PDF to take with you to the clinic if needed. When you visit our page, you can browse topics, and we can filter by evidence-based urgent care, and you'll see all of our previous issues so far. Our most recent one was low-risk chest pain in an urgent care setting, and we're going to dive a little bit deeper into closed head injuries in an urgent care setting from May of this year. So if you're short on time, you can go directly to the points and pearls section. You're going to be provided with a summary of key points, the must-know information in just about 60 seconds. When you're ready to take a deeper dive and get the full content, you can click on full issue. And here you're going to be presented with practical evidence-based recommendations that you can use on your next shift. Each month, each article is going to follow a consistent format, so you can quickly find the information that you're looking for. Each issue is going to start with case-based presentations based off of real-life urgent care scenarios and patients that are going to help you identify high-risk patients and atypical presentations. I'm going to pull up the table of contents on the left, which helps you easily navigate through the entire issue. So after a brief overview of the pathophysiology and the epidemiology, we come to urgent care evaluation and management. Here you're going to find practical recommendations for the evaluation and management of your patients in the urgent care setting. We're not going to cover things that you already know. We're going to focus on high-risk, commonly missed presentations and conditions, and we'll give you quick access to best practices and key takeaways. In this section, you'll also be presented with any sort of relevant video content, for example, physical exam techniques that might help sharpen and hone your skills. The diagnostic testing section covers labs and imaging options for you to consider in the workup of your patients. We're going to pay particular attention to the resources that may or may not be available and relevant to you in an urgent care setting. Again, we'll go to the table of contents on the left. We're going to go to a section that's a favorite of a lot of our subscribers. So we're always going to cover special populations, controversies, and circumstances that focus on practical takeaways that you can apply to your next urgent care shift. We also include kid bits. We're going to cover unique aspects of pediatric care to help you manage that patient population. Again, using the table of contents, we're going to go to another favorite area of a lot of our subscribers, the risk management pitfalls. Sometimes these are referred to as excuses that don't work in court. These potential pitfalls will help you avoid costly mistakes in managing your patient care. Of particular interest to the medical directors, CMOs, or really anyone who has to worry about the bottom line in addition to providing excellent patient care is the charting and tips section. Here you're going to be provided with simple changes that you can make to your current documentation that will help ensure your clinic gets the full reimbursement for all of the services that you provide. Each issue will include at least one clinical pathway. It's going to give you an easy to follow algorithm for patient care. A lot of our subscribers are using these algorithms as the basis for protocols in their clinics. One unique feature of these clinical pathways is that we're going to include the level of evidence, the associated definitions down here below. So at evidence-based urgent care, we're going to review hundreds of articles to create these courses and pathways. You're going to find a critical appraisal of the literature that summarizes the quality of the evidence on the topic at the end of each course. You'll also find a reference list at the end of each course. And one of the unique things about us is for all of the references that we're going to provide you, we're going to include information about the type of study, the number of patients, giving you that additional insight about the evidence that you're using. So that's really our issue in a nutshell. I'm going to scroll back up to the top. So as I mentioned, a new issue is published each month. It includes 4 CME credits, and subscribers will get access to all of our published issues in the past. One of the things that makes us unique is our focus on helping you retain all of this information. We're going to provide you with the content in multiple formats to help reinforce learning, including those clinical pathways I talked about and risk management pitfalls. Of course, we're going to include the 60-second pearls and points. You'll also have access to postscripts to help test your knowledge, and calculated decisions through our partnership with MD Calc, which is going to provide you with relevant risk scores and calculators. Once you finish, you can simply click on Take CME Test and answer the questions to obtain your 4 CME credits. So to summarize what makes evidence-based urgent care different than the other educational resources out there. So we're laser focused on the practical application of the evidence, helping you learn and retain the knowledge that will truly improve your patient care and improve the bottom line for your clinics. It's designed to be read while you're not on shift to truly help you prepare for your next shift and your next patient. But you can also use it as a point of care to search for our clinical pathways and other relevant content. Upcoming issues include influenza, STIs, red eyes, pediatric bronchiolitis, and more.